Hello everyone, I am Mujdan Kamil. In this video, we will see my summary of the lecture, so let's get started. So at the beginning, we have to know what is the cough and what's the etiology of the cough. So basically, cough is a symptom that may result from different reasons and disease. Infectious cough is an example, and it can be either upper respiratory tract infection, which is the most common cause, and it's present as a common cold, or it can be pneumonia, which is the most common cause of acute cough, or it can be influenza, tuberculosis, or pertussis, which is the whooping cough. So here is some disease to be considered as disease-related cough, such as asthma, pulmonary embolism, chronic obstructive pulmonary disease, upper airway cough syndrome, heart failure, gastroesophageal reflux disease. ACE inhibitors are one of the most commonly implicated medications for drug-induced cough, and it has been described as a persistent dry cough. Patient assessment using the scholar approach provides a systemic framework to elicit the necessary information and to clarify the differential diagnosis, also to identify the red flag features. So here we will ask the patient to describe his symptoms, like if he's producing any sputum, if he have vomiting, chest pain, sore muscles, fever, or shortness of breath. So here we will ask him about the characteristic of the cough, if it's dry cough or wet cough. So one of the most important thing is the history of the patient. We have to ask him if he smokes cigarettes, what's his medical history, and what's the medication history. And for example, ask him if he have recently started taking any new medications. Also, it needs to be considered. For example, is your cough worse at night, or how long have you had your cough? Also, the location. For example, if the patient has chest pain, expert's location. Identifying the triggers can help the patient to avoid them. This can also help identifying the etiology of the cough. For example, if exercise, cold air, or talking, or environmental triggers make it worse. So finally, we have to know what is the red flags, and it's one of the important things that we have to know, which is signal a need for referral to another healthcare practitioner or the emergency room in some cases, and the pharmacist to play a key role in identifying the patient who have red flag features. I hope you enjoyed that you see my video, and I appreciate that.